There was a time when wealthy American billionaires controlled global health decisions. When African leaders had to beg for medical supplies and accept whatever conditions came with foreign aid. When saying no to Bill Gates meant watching your people suffer without essential medicines. But on March 8, 2024, everything changed when Ibrahim Traoré made an offer that Bill Gates couldn't accept. If this shocking story of how the tables turned on global health power moves you, please hit that like button and subscribe to our channel. For more stories about real leadership changing the world, what you're about to witness isn't just about money or politics. It's the moment when African innovation met Western arrogance head-on. When a 36-year-old president offered revolutionary healthcare solutions that threatened a $70 billion foundation's entire business model. When Bill Gates learned that some breakthroughs can't be bought, controlled, or buried. Ibrahim Traoré walked into that Geneva conference room with a briefcase full of medical research that would change everything. He had discoveries that could save millions of lives at a fraction of current costs. He represented breakthrough treatments developed by African scientists that Western pharmaceutical companies feared most. For the first time in decades, an African leader was offering to help the West instead of asking for help, but sometimes pride costs more than lives. And on this day, Bill Gates made a decision that would cost his foundation $12 billion and teach the world that innovation doesn't always come from Seattle laboratories. Some of the greatest medical breakthroughs come from the places you'd least expect. This isn't speculation. These are documented facts from conference recordings, leaked emails, and verified patent applications that shocked the medical world. Before this historic confrontation unfolded, you need to understand how these two men found themselves in a meeting that would reshape global healthcare forever. This wasn't supposed to be a negotiation between equals. It was supposed to be another routine charity presentation. Bill Gates had spent over 20 years building the most powerful health empire in human history. With the Gates Foundation controlling $70 billion and directly influencing WHO policies, he had become the unofficial king of global health decisions. His approach was simple but effective. Identify health problems in poor countries, fund research in American and European laboratories, then distribute solutions through carefully controlled programs. Gates had built relationships with every major pharmaceutical company, university research center, and government health ministry that mattered. When the Gates Foundation spoke, the global health community listened. His foundation had eradicated diseases, distributed billions of vaccines, and saved countless lives using this proven model. But there was one thing Gates had never encountered: African scientists developing breakthrough treatments that could compete with Western research. His entire system was built on the assumption that real medical innovation happened in wealthy countries and was then shared with the developing world. The idea that cutting-edge research might emerge from Africa itself had never seriously crossed his mind. Gates's team had prepared for this meeting expecting to discuss typical foundation business funding requests, distribution partnerships, or implementation support for existing programs. They had no idea they were about to face something completely unprecedented. Captain Ibrahim Traoré represents something entirely new in global health, an African leader whose country had achieved medical breakthroughs that could revolutionize treatment worldwide. Since taking power in September 2022, Traoré had quietly invested in rebuilding Burkina Faso's research capabilities, partnering with scientists who had been overlooked by the international community, working with traditional healers, local universities, and innovative researchers. Burkina Faso had developed treatments for malaria, diabetes, and infectious diseases that were not only more effective than existing options but cost 90% less to produce. These weren't traditional remedies or experimental treatments. These were rigorously tested, scientifically validated medicines that had passed every international safety standard. The breakthrough had started with Dr. Mariam Ouedraogo, a brilliant biochemist who had returned to Burkina Faso after completing her PhD at Harvard. Working with traditional plant medicines and modern chemistry, her team had isolated compounds that showed remarkable effectiveness against multiple diseases. Early trials had produced results that seemed almost too good to be true, but Traoré understood something that many African leaders had missed: medical breakthroughs meant nothing without the political and economic power to bring them to market. That's why he had requested this meeting with Gates, not to ask for funding, but to offer partnership in developing and distributing treatments that could transform global health. The philosophical difference between these two men represented a fundamental shift in global power dynamics. Gates embodied the traditional model where wealthy foundations controlled medical innovation and distributed it to grateful recipients. Traoré represented a new reality where breakthrough solutions could emerge from anywhere and demanded to be taken seriously. Gates believed his foundation's resources and expertise naturally qualified him to determine which medical approaches deserved global attention. Traoré knew his country's discoveries were revolutionary and expected Gates to recognize their value as an equal partner rather than a charitable recipient. Most importantly, while Gates viewed Africa as a market for Western medical solutions, Traoré saw Africa as a source of medical innovation that could benefit the entire world. The stage was set at the World Health Innovation Summit in Geneva, Switzerland. The setting was deliberately neutral, a luxury hotel conference room where global health leaders regularly met to discuss partnerships and funding. The agenda listed this as a routine meeting between the Gates Foundation and Burkina Faso's health ministry. Gates arrived with his standard team of medical advisors, legal experts, and program managers. Their strategy was to listen politely to whatever request Traoré might have, then explain how the foundation could provide appropriate assistance through existing channels. They expected a typical conversation about funding needs or technical support. Traoré's preparation was completely different. He had brought Dr. Ouedraogo patent lawyers and detailed research data that would prove his country's medical discoveries were legitimate game changers. His approach reflected someone who understood that this meeting could either launch African medical research into global prominence or see it buried by established interests. As Traoré had learned from Thomas Sankara, we must produce what we consume and consume what we produce. Those words, spoken decades earlier, had guided every decision about developing domestic medical research capabilities that would soon shock the global health establishment. The Geneva Hotel conference room overlooked Lake Geneva, its floor-to-ceiling windows framing the snow-capped Alps in the distance. Bill Gates sat at the head of an oval mahogany table, surrounded by his foundation team, all carrying tablets, smartphones, and the confident air of people who controlled billions in global health funding. Dr. Melinda Rodriguez, the foundation's Director of African Health Initiatives, opened her leather portfolio and activated her presentation screen. President Traoré, she began with practiced warmth, we're delighted to explore how the Gates Foundation can support Burkina Faso's health development goals. The foundation team expected this to unfold like hundreds of similar meetings. African leaders would present their challenges, the foundation would offer existing solutions, and everyone would sign agreements that channeled funding through established programs. But Traoré surprised everyone by raising his hand politely before Dr. Rodriguez could continue. Thank you, Dr. Rodriguez, but I think there may be some confusion about the purpose of this meeting. His voice carried quiet confidence that immediately shifted the room's energy. Gates leaned forward slightly, his expression showing mild curiosity, mixed with the slight impatience of someone whose time was extremely valuable. We didn't request this meeting to seek funding or support, Traoré continued. We requested it to offer the Gates Foundation an exclusive partnership opportunity for medical discoveries that could revolutionize global health treatment. The foundation team exchanged glances. In 20 years of African partnerships, no one had ever opened a meeting by offering discoveries to them. Dr. Mariam Ouedraogo rose gracefully and activated her own presentation system. Mr. Gates, over the past 18 months, our research teams in Burkina Faso have achieved breakthrough results in treating malaria, diabetes, and several infectious diseases using novel compounds derived from indigenous plants. She clicked to her first slide, showing clinical trial results that made several foundation advisors sit up straighter. Our malaria treatment shows 94% efficacy with 0 recorded side effects. Treatment cost, approximately 30 cents per patient. Duration: single dose, permanent immunity for up to 5 years. Gates's expression shifted from polite attention to sharp focus. The numbers Dr. Ouedraogo was presenting represented outcomes that seemed almost impossible with current medical technology. Dr. Ouedraogo, Gates interrupted, his tone carrying the authority of someone who had reviewed thousands of medical claims. Those results would be remarkable if verified. But traditional medicine claims often don't hold up under rigorous scientific testing. His comment carried the unconscious assumption that real medical research happened in established Western laboratories, not in African facilities that most global health experts had never heard of. Dr. Ouedraogo smiled calmly. Mr. Gates, these results have been verified by 3 independent laboratories: the Swiss Institute for Tropical Medicine, Johns Hopkins School of Public Health, and the Pasteur Institute in Paris. All testing was conducted under double-blind protocols with peer review. She distributed thick folders containing laboratory reports, patent applications, and verification letters from institutions that Gates's team recognized and respected. The atmosphere in the room began to change as the Gates Foundation team realized they were dealing with legitimate scientific breakthroughs rather than typical traditional medicine claims. Furthermore, Dr. Ouedraogo continued, her voice gaining strength, our diabetes treatment has achieved complete reversal of type 2 diabetes in 89% of test subjects. Treatment cost, $1.20 per patient. No ongoing medication required permanent metabolic correction. Gates's chief medical advisor, Dr. James Chun, began frantically cross-referencing the documents with his tablet. The results Dr. Ouedraogo was presenting would represent the most significant medical breakthroughs in decades if they were real. Our tuberculosis treatment shows 100% cure rate in drug-resistant cases that have failed all existing therapies. Treatment duration, 7 days. Cost, $2.40 per patient. Each statistic landed like a physical blow to the Foundation team's assumptions about where medical innovation originated. This is... Gates paused, clearly struggling to process what he was hearing. Dr. Ouedraogo, if these results are accurate, why haven't we heard about this research through normal channels? The question revealed everything about how the global health establishment operated. Breakthrough discoveries were supposed to emerge from funded research programs that major foundations knew about and controlled. Traoré answered calmly, Mr. Gates, we developed these treatments outside the traditional funding system specifically to maintain intellectual property rights and avoid external control over our research directions. Dr. Ouedraogo clicked to her next presentation section, revealing documents that sent shockwaves through the Foundation team. We have filed provisional patents on 17 distinct compounds and 3 revolutionary treatment protocols. Patent applications are currently under review in the United States, European Union, China, and India. Gates's face went pale as he realized the implications. If Burkina Faso controlled patents on breakthrough treatments, it would fundamentally alter global health economics and power dynamics. Estimated global market value for these treatments, $180 billion annually, Dr. Ouedraogo announced. Potential cost savings to global health systems, over $500 billion per year through reduced hospitalization, shorter treatment duration, and elimination of chronic medication dependencies. Dr. Chen leaned over to whisper urgently in Gates's ear, but Traoré could see the concern spreading across the Foundation team's faces. These weren't just medical breakthroughs, they were potential threats to the entire pharmaceutical industry that the Gates Foundation worked closely with. President Traoré, Gates said, his voice carrying new gravity, assuming these results are legitimate, what exactly are you proposing? The moment of truth had arrived. We're offering the Gates Foundation exclusive global distribution rights for these treatments, Traoré announced. In exchange for acknowledging Burkina Faso as an equal partner in global health innovation and ensuring fair compensation for our intellectual property. The offer was extraordinary access to breakthrough treatments that could save millions of lives and generate enormous profits, with the condition that Africa be treated as a partner rather than a charity case. But what happened next transformed the meeting from a business negotiation into something far more personal and profound. "Mr. Gates," Traoré said, his voice carrying deep emotion, "let me tell you why this matters to me personally. When I was 12 years old, my father died from diabetes because insulin was too expensive for our family to afford consistently." The room fell silent as Traoré shared pain that millions of African families had experienced. I watched him ration his medication, skipping doses so the supply would last longer. I saw him grow weaker every day because the treatments that could save his life were priced beyond our reach. Gates shifted uncomfortably, recognizing that this wasn't just about business or science, it was about human suffering caused by medical economics. "When I became president," Traoré continued, "I made a promise to my father's memory. If African scientists could develop better treatments at lower costs, we would never again watch our people die because medicine was too expensive." Dr. Ouedraogo nodded, her eyes reflecting shared commitment. "Every member of our research team has lost family members to diseases that were treatable but unaffordable. Our work isn't just scientific research, it's a moral mission. Our diabetes treatment has already been distributed freely to 50,000 patients in Burkina Faso," Traoré explained. "We've documented complete reversal of the disease in almost every case. Children who were facing lifelong insulin dependence are now completely healthy." He activated a video screen showing testimonials from patients whose lives had been transformed by treatments developed in laboratories that the global health establishment had never taken seriously. As Gates watched footage of African children celebrating their freedom from diabetes medications, his expression reflected deep internal struggle. The humanitarian in him was moved by the evidence of lives being saved. But the foundation executive in him was calculating the economic implications of treatments that could eliminate billion-dollar medication markets. "President Traoré," Gates said carefully, "these developments are remarkable. But bringing new treatments to global markets requires extensive testing, regulatory approval, and distribution infrastructure that takes years to develop." Traoré looked Gates directly in the eyes. "Mr. Gates, are you suggesting that African-developed treatments require more testing than identical treatments developed in Western laboratories? Or are you concerned that our treatments might work too well and cost too little?" The question hung in the air like a challenge to everything the Foundation represented. Gates realized he was facing a leader who understood exactly how global health economics worked and wasn't intimidated by the implications. "Because if you're worried about disrupting existing pharmaceutical profits," Traoré continued, "then you should know that we have other options for bringing these treatments to the world." The moment that would cost Bill Gates $12 billion was about to unfold. What happened next would be analyzed by business schools, medical ethics committees, and international development experts for years to come. After a long pause, Gates made the calculation that would define his legacy and cost his foundation more money than any decision in its history. "President Traoré," he said slowly, "while these developments are interesting, the Gates Foundation has existing partnerships and commitments that we need to honor." His voice carried the weight of someone who had made a decision that prioritized established relationships over revolutionary breakthroughs. "We appreciate your country's research efforts, but we believe our current approach to global health challenges is the most effective way to save lives and improve outcomes." The rejection was polite but unmistakable. Gates was choosing to protect the existing pharmaceutical industry relationships that his foundation depended on rather than embrace African innovation that could transform global health. Traoré's reaction was calm but carried the authority of someone who had anticipated this exact response. "Mr. Gates, I want to be certain I understand your position. Your declining partnership with treatments that could save millions of lives and reduce global healthcare costs by hundreds of billions of dollars." Gates shifted uncomfortably. "President Traoré, it's not that simple. Global health systems are complex, and introducing new treatments requires—" "No," Traoré interrupted quietly. "It is that simple. You're choosing pharmaceutical industry? Profits over human lives. You're choosing Western control over African innovation. You're choosing the status quo over revolutionary progress. Dr. Ouedraogo activated her final presentation slide, revealing information that would shatter Gates's assumptions about his foundation's global influence. Since we anticipated this response, she announced, we have already secured alternative partnerships for global distribution of our treatments. The slide showed logos that made Gates's team gasp audibly: the Chinese National Health Commission, the Russian Ministry of Health, the Brazilian National Health System, and the Indian Council of Medical Research. Combined population served by our alternative partners, 3.2 billion people. Dr. Ouedraogo continued. Projected revenue from treatment sales, $15 billion annually, with 60% of profits returning to African research and development. Furthermore, Traoré announced, delivering the information that would become international headlines, the World Health Organization has agreed to fast-track approval for our treatments based on existing verification data. He paused, assuring. Gates understood the full implications of what he was about to hear. 18 African nations have committed to purchasing our treatments exclusively, ending their relationships with Western pharmaceutical suppliers. Combined annual pharmaceutical spending being redirected from Western companies to African production. $12 billion. Gates sat in stunned silence as he realized the magnitude of what his rejection had cost. He hadn't just refused a partnership, he had triggered the largest transfer of pharmaceutical market share from West to South in history. Mr. Gates, Traoré said, standing to deliver his final statement, you built your foundation on the assumption that medical innovation flows from rich countries to poor countries. You've just learned that assumption is wrong. He moved to the window overlooking Lake Geneva, the symbolic heart of international cooperation. The future of global health will be determined by countries that prioritize saving lives over protecting profits. Today you chose which side of history you want to be on. Dr. Ouedraogo distributed final documents that completed the foundation team's humiliation. These are letters of intent from the governments of Nigeria, Kenya, Ethiopia, and Ghana to establish African research centers using our breakthrough methodologies. Total investment committed to African medical research, $8 billion over 5 years. Number of African scientists who will be trained in breakthrough treatment development, 10,000. Gates realized he wasn't just losing money, he was witnessing the birth of an African medical research network that could make his foundation irrelevant across an entire continent. Traoré's reaction was calm but carried the authority of someone who had anticipated this exact response. Mr. Gates, I want to be certain I understand your position. You're declining partnership with treatments that could save millions of lives and reduce global healthcare costs by hundreds of billions of dollars? Gates shifted uncomfortably. President Traoré, it's not that simple. Global health systems are complex and introducing new treatments requires— No, Traoré interrupted quietly. It is that simple. You're choosing pharmaceutical industry. Profits over human lives. You're choosing Western control over African innovation. You're choosing the status quo over revolutionary progress. Dr. Ouedraogo activated her final presentation slide, revealing information that would shatter Gates's assumptions about his foundation's global influence. Since we anticipated this response, she announced, we have already secured alternative partnerships for global distribution of our treatments. The slide showed logos that made Gates's team gasp audibly: the Chinese National Health Commission, the Russian Ministry of Health, the Brazilian National Health System, and the Indian Council of Medical Research. Combined population served by our alternative partners, 3.2 billion people. Dr. Ouedraogo continued. Projected revenue from treatment sales, $15 billion annually, with 60% of profits returning to African research and development. Furthermore, Traoré announced, delivering the information that would become international headlines, the World Health Organization has agreed to fast-track approval for our treatments based on existing verification data. He paused, assuring. Gates understood the full implications of what he was about to hear. 18 African nations have committed to purchasing our treatments exclusively, ending their relationships with Western pharmaceutical suppliers. Combined annual pharmaceutical spending being redirected from Western companies to African production, $12 billion. Gates sat in stunned silence as he realized the magnitude of what his rejection had cost. He hadn't just refused a partnership, he had triggered the largest transfer of pharmaceutical market share from West to South in history. "Mr. Gates," Traoré said, standing to deliver his final statement, "you built your foundation on the assumption that medical innovation flows from rich countries to poor countries. You've just learned that assumption is wrong." He moved to the window overlooking Lake Geneva, the symbolic heart of international cooperation. "The future of global health will be determined by countries that prioritize saving lives over protecting profits. Today you chose which side of history you want to be on." Dr. Ouedraogo distributed final documents that completed the Foundation team's humiliation. These are letters of intent from the governments of Nigeria, Kenya, Ethiopia, and Ghana to establish African research centers using our breakthrough methodologies. Total investment committed to African medical research, $8 billion over 5 years. Number of African scientists who will be trained in breakthrough treatment development, 10,000. Gates realized he wasn't just losing money, he was witnessing the birth of an African medical research network that could make his foundation irrelevant across an entire continent. "President Traoré," Gates said desperately, "perhaps we could reconsider the terms of partnership. The foundation is always open to innovative approaches." "Mr. Gates," Traoré replied with finality, "the opportunity for partnership expired when you chose to protect pharmaceutical industry profits over African innovation. We don't need your foundation's approval to save lives." As Traoré prepared to leave, he delivered words that would be quoted in medical schools and development programs worldwide. History will remember this day as the moment when African medical innovation declared independence from Western gatekeepers. He gathered his documents and stood to shake Gates's hand. "Your foundation is welcome to purchase our treatments through the same channels as everyone else. But the era of controlling African research through conditional funding is over." As the African delegation left the conference room, Gates sat motionless, his foundation team staring at documents that proved they had just witnessed the biggest shift in global health power dynamics since the founding of the World Health Organization. Dr. June was the first to speak. "Bill, do you realize what just happened? We just lost the entire African pharmaceutical market to African competitors we didn't even know existed." Gates slowly removed his glasses and rubbed his eyes. "Get me a meeting with our pharmaceutical partners. We need to understand how African research capabilities advanced this far without our knowledge." But it was too late. The decisions had been made, the partnerships had been signed, and the future of global health had shifted from Seattle to Africa in a single afternoon. The richest man in the world had just learned that some opportunities only come once, and pride costs more than money. As news of this unprecedented rejection spread across the globe, the world witnessed a fundamental shift in global health, international development, and the relationship between innovation and power that would reshape medicine for generations. Within 72 hours, the story had become front-page news worldwide. African medical schools received thousands of applications from international students wanting to study breakthrough treatment development. Stock prices for major pharmaceutical companies dropped by an average of 12% as investors realized that cheap, effective treatments could eliminate billion-dollar drug markets overnight. But the most significant reaction came from patients. Videos of diabetic children in Burkina Faso celebrating their freedom from daily insulin injections went viral, generating over 100 million views. Families affected by malaria, tuberculosis, and other diseases began demanding access to African-developed treatments that their governments had never heard of. The World Health Organization announced an emergency review of treatment approval processes, acknowledging that breakthrough discoveries could emerge from anywhere and deserved rapid evaluation, regardless of their country of origin. The financial implications were staggering and immediate. The Gates Foundation's influence in Global health policy collapsed as countries realized they had alternatives to Western-controlled medical programs. African pharmaceutical companies, previously dismissed by international investors, began receiving billions in development funding from Asian and Middle Eastern sources. More importantly, the success of African medical innovation proved that breakthrough research didn't require massive foundation budgets or high-tech laboratories. Brilliant scientists working with limited resources but unlimited determination could achieve results that billion-dollar research programs had failed to accomplish. Traoré's breakthrough treatments taught the world that medical innovation flourishes when researchers are motivated by saving lives rather than generating profits. African scientists working without the constraints of pharmaceutical industry partnerships had achieved results that seemed impossible within traditional research frameworks. The lesson was profound. When researchers prioritize patient outcomes over patent protection, medical breakthroughs happen faster, cost less, and work better than profit-driven alternatives. Perhaps most importantly, the confrontation demonstrated that intellectual sovereignty was just as important as political sovereignty. Traoré had proven that African nations could control their own medical research, develop their own solutions, and demand respect as equals rather than charity recipients. Countries across the global South began investing in domestic research capabilities, recognizing that medical independence was essential for true national sovereignty. Gates's rejection taught a costly lesson about the difference between genuine partnership and philanthropic control. His foundation had become so accustomed to managing African health programs that it couldn't recognize African innovation when it was offered as an equal partnership. The new model required mutual respect, shared decision-making, and recognition that breakthrough solutions could emerge from any corner of the world. This moment fulfilled Thomas Sankara's vision of African self-reliance and innovation. Traoré's generation had learned from history and chosen to build African capabilities rather than depend on foreign charity. No matter how generous or well-intentioned, 6 months later, African-developed treatments had been distributed to over 2 million patients across 4 continents. The mortality rate from drug-resistant tuberculosis dropped by 78% in countries using Burkina Faso protocols. Diabetes treatment costs fell by 95% in nations that purchased African-manufactured medicines. Most remarkably, medical schools worldwide began studying African treatment methodologies, recognizing that some of the most effective approaches to global health challenges had emerged from the continent. Historically dismissed as medically dependent, the Ouagadougou model of research and development spread rapidly to other fields. African universities began developing breakthrough technologies in agriculture, renewable energy, and information systems, demanding recognition as innovation centers rather than aid recipients. International development organizations were forced to completely restructure their approaches, acknowledging that sustainable progress required supporting local capacity rather than replacing it with external management. For individuals and organizations facing similar choices between comfortable dependency and challenging independence, Traoré's example provided a clear blueprint. Invest in your own capabilities, demand respect as an equal, and never accept partnerships that compromise your dignity or long-term independence. In the end, Bill Gates learned an expensive lesson about the cost of underestimating African capabilities and the price of choosing control over collaboration. His $12 billion loss became Africa's $12 billion gain in medical independence, research capacity, and global respect. As Traoré said in his address to the African Union 3 months later, when we choose to build our own solutions rather than beg for foreign charity, we don't just change our own future, we prove to the world that African innovation can lead global progress. The young president from Burkina Faso had reminded the world that true medical breakthroughs come from passion for saving lives, that innovation recognizes no borders, and that the future belongs to those who choose dignity over dependency. Don't forget to like this video and subscribe to our channel for more inspiring stories about leaders who choose innovation over intimidation and partnership over patronizing charity. Your support helps us share these important lessons about authentic progress and genuine equality with the world.